Welcome to Robert Wood Johnson University Hospital Somerset's Health Talk. I am Dr. Douglas Ashinsky of RWJBarnabas Health Medical Group. Rehabilitation services can help individuals with wide variety of health conditions, including those recovering from surgery or a stroke, and those with chronic medical problems such as heart disease, diabetes, and cancer. On today's show, we'll learn more about the benefits of rehabilitation services for people of all ages and new services available at Robert Wood Johnson University Hospital, Somerset. We are pleased to be joined by Gary Benedict, an exercise physiologist with Robert Wood Johnson University Hospital, Somerset's Cardiac Rehabilitation Department, and Danielle Bowden, a physical therapist at Robert Wood Johnson University Hospital, Somerset. In accordance with social distancing due to the COVID-19 pandemic, our guests will be joining us remotely via video conferencing. Thank you both for being here today. First, I will let the studio audience wants to know a little bit about yourselves and your background. So we'll start off with Gary Benedict, who's an exercise physiologist, and then we'll follow up with Danielle Bowden, who's a physical therapist. So Gary, tell us a little bit about you, your background, and what got you into doing what you're doing.
Sure. Nice to be here, Doctor. Well, I've been basically working in this health and fitness field as an exercise physiologist for the last 35 plus years. The last 25 years of it is I worked for Somerset Medical Center, and 16 of those years was in outpatient cardiac rehab, which I'm currently doing right now. Over the years, I've worked with a variety of different populations, everything from children to seniors to athlete, fitness enthusiasts. But mostly I've probably dealt with patients or individuals that have some type of medical condition. They're coming off of some type of rehab program, and exercise can help to improve them. So I've worked with people, everything with cardiovascular disease, people coming off of post-rehab, diabetes, weight control, post-CVA. Once they've gone through various therapies, such as what Danielle would work with, then they need to continue to exercise. I can step into the play. Currently, right now, with our cardiac rehab program, we deal with individuals who have had heart attacks, bypass surgeries, angioplasties, heart failure, valve repairs, and even heart transplant patients. So that's the general background of my history of working in this field.
And Danielle?
Yes, my name is Danielle. I work for Somerset RWJ, but I am in an off-site facility. It's located at the Patriot Stadium. So it's the sports physical therapy orthopedics. I have been here at this facility for about 14 of my last 23 years of treating. So I started out in another healthcare facility, another hospital-based program. So very similar. I love working in a hospital-based outpatient because I feel like their ethical code and their practices are really spot on with my ethical code and the way I practice. So I work in an outpatient facility, primarily with outpatient orthopedics, which I always fondly like to say, people who are clothed versus in the hospital where they're wearing, the gowns and slippers. Our patients put their clothes on and come out of their house for therapy most of the time. So we treat conditions such as neck pain, back pain. You'll hear people say, I have shoulder tendonitis or a rotator cuff tear. Post-op surgeries for those corrections, sometimes laminectomies, which is a spinal surgery, the rotator cuff repairs, more so recently some shoulder reconstructions or replacements. We get lots of total knee replacements. Athletes who sprain their ankles or we get a lot of athletes that injure themselves, but not in a very obvious way. Nothing is broken, nothing is torn, but they come out and to the parents and say, like, my back really hurts when I swing or when I throw or vice versa. So we have the athlete population as well as I call the weekend warrior population, which is the people who usually come either very early before work and then go to work, or the people who come after work and they're looking for nights and even weekend appointments, which I work also Saturdays. In the middle of the day, we tend to see some of our more elderly population, or those who are retired and who have the ability to get here during working hours. So we see a lot of, chronic pain, osteoarthritis pain, just generalized, my body's breaking down on me and I really don't feel good and I can't function the way I used to.
Well, the good news is you work at a terrific place at the RWJBarnabas Health. The TD Park is a terrific place to do both rehab as well as activities, for sports. As a primary care physician, I have sent numerous people over there for things such as carpal tunnel, tennis elbow, sore shoulders, bursitis of the shoulders, knee discomfort. The weekend warrior who went golfing and swung poorly, and now suddenly they're developing the pain. And I even have the teenagers, the older teenagers, and the college kids who are playing soccer, playing baseball, etc., and they overuse something, and I need the help in order for them to get back into the sport that they're able to do.
Right. And we appreciate your referrals.
So the thing that I want the audience to understand is all of the range of modalities that you have. Can you give us an overview of all of what you do over there?
Sure. So when patients hear or people hear modalities, they think, what the heck is that? So I usually say they're tools in our tool belt, our therapy tool belt. So in each pocket, we have different tools. So when they come in and we, as you said, we evaluate them and we're trying to figure out the root cause, not just the symptom. And when we find that, we figure out what can we, in a way, throw at them to improve the situation. So we use things like postural education. And this is one that we drive home a lot because that's half of what got people where they are, is we sit a lot. We sit at our computer or our desks. We're on our technology a lot. So we need to understand the repercussions of our postures and how it might cause shoulder or neck pain or back pain, or an athlete who's trying to perform at the top of their game, yet they've been sitting in a slouch position all day and they're expected to be able to extend and perform these various activities. So postural education is huge. We also talk about body mechanics. So, with typical people, we look at how do they squat down to pick something up, or how do they reach overhead to get something, and what is safe for safe lifting and body mechanics. So we have posture, we have body mechanics. We do range of motion exercises and stretching. So if something is tight and not moving, you want it to move. So you want it to move the same way on both sides. You don't want somebody to be able to reach across their shoulder here, and on this side, they can only get to here. That creates further dysfunction in your body when you're trying to compensate. We also do strengthening exercises, in order to maximize the use of maybe weakened or deconditioned or atrophied muscles. Sometimes I call them dumb. We have people who, for the rest of their life, we encourage them to do these specific strengthening exercises because the body has the path of least resistance, which is if I tend to, slouch my head forward, well, the front of my neck is going to get very weak, but tight, and then the back is going to be overstretched. So strengthening exercises would be necessary to activate the proper postural muscles. We then use things such as our hands-on techniques, which include massage, myofascial release. We do joint mobilizations. We do fascial counterstrain, which is something that I myself and one of my other coworkers do in the clinic, which is hard to find around here. We have people who travel from Pennsylvania, from an hour away in New Jersey, looking for fascial counterstrain therapists in order to find treatment. We also add, I almost call it the icing on the cake. It's not the necessity, it's not the part of the therapy that makes or breaks your therapy, but for pain management concerns and to kind of accelerate your healing and your comfort, we use modalities such as electric stimulation, ice, heat, and we also have what's called the Game Ready, which is a compression ice device that you secure to the body part, and it can actually provide compression with the cold at the same time.
Thank you.
Yeah, that's to increase their comfort.
Thank you. And Gary, what are the goals of all of this rehabilitation services?
Well, ultimately, the ideal goal is to get people back to their pre-injury, pre-disease condition so they can improve the function of whatever they have to do in life. So that's like the main objective of probably any type of rehab. Let's get them back to where they were prior to. But in certain situations where maybe the individual can't get back to that, then the secondary goal of the rehab would be to educate them and provide them with various skills and knowledge that would allow them to manage their medical condition, and so they can still, be productive and return to an active lifestyle.
So we're looking to try to get them to the pre-injury state, and if we can't get them to the pre-injury state, educate them that we can get them as close to it as possible and be able to do as much as possible, but we may have a couple of limitations on it.
Exactly. Give you an example, like in the outpatient cardiac rehab department I currently work in over here in Hillsborough. Once individuals have had, say, a heart attack or angioplasty, or there's some type of cardiovascular disease process going on, one of the goals is to really educate them as to what they can do, of how they can use exercise to help combat, the cardiovascular disease process, nutritional counseling, also psychological counseling in terms of how to manage stress. So we can give them the tools that they need. So then once they are done with this, hopefully they can go out and once again be able to function in life and get back to the levels that they want to perform.
And again, being that you do cardiac rehab, it's also important that after they've had either a bypass, angioplasty, or had a heart attack, get them back to doing exercises, and again, in a monitored environment so that we're not overtaxing them, and then being able to work with the person to continue to improve them, to get them as close to as possible their pre-cardiac condition.
Exactly. And when patients come to us here, the first phase when they enter us in an outpatient, it's called phase 2. So what we'll do is we actually have them hooked up with the telemetry monitored so we can see their heart rates and rhythms as they're exercising. We'll monitor their blood pressures. We can monitor their oxygen levels, to progressing them. But once again, and also giving them the education and the tools that once they eventually leave us, they can continue to self-monitor themselves and continue with it. We also do have a program here that we just initially started. It's called phase 3. So these are for the individuals that have graduated from the monitored program, phase 2, and maybe they don't feel quite comfortable yet going out into a gym setting or out into the community, or they need a little bit more help or self-confidence. So they can actually continue with us after they're done with the monitored program. And, we will once again continue to progress them, although they're not on the EKG telemetry in that particular phase.
Which is terrific. It's terrific that you're able to do that, and you also communicate back to the primary care and or the cardiologist how the person is progressing, along with diagrams, figures on how their EKG, blood pressure, et cetera, is doing while they're doing the rehab, which I couldn't get at a gym facility if they went to one.
Right. Yep. Particularly in the phase 2 program, reports are sent back to the referring physician documenting progress and showing the various vital their vital signs and how they're progressing.
Now, Gary, I also understand that you recently launched a special exercise program for individuals who are recovering from COVID-19. Do you want to tell us, one, what type of symptoms these people have, and then what your program entails?
Sure. Yeah, and although the program is still in its infancy, but basically what we're finding out, I guess, over the last year, that individuals that have, came down with COVID and they recovered from it, a certain percentage of those individuals tend to have a variety of different complications, even after they've recovered from it. We've seen everything from people complaining of excessive fatigue, shortness of breath. They could be getting chest pain, rapid heart rates, some type of muscular or joint pains or discomfort. And there's even, a whole phenomena where they're finding out, I guess, COVID-19 is causing some type of significant cardiovascular issues, maybe with clotting. So people are having heart attacks after it. They could be having potentially strokes. They've discovered people are recovering. There's neurological issues that I'm sure Danielle can speak to, a lot better. And I'm sure over at the ballpark, they probably dealt with some of these patients coming over after, initially discharged. There's cognitive memory issues. I think one of the terms they use is foghead or brain fog. People are affected. And there's also a variety of different psychological issues that people are having to deal with after this, such as mood changes, depression, some levels of anxiety, GI issues. So currently we're finding out, and once again, it's still in its infancy, but we're finding out that, a variety of multi-systems in the body can be affected by the COVID disease process. And, they've given the name, I guess, of these individuals of long COVID or long haulers, to try to give it a special title. So what we're trying to do is for those individuals that may have recovered, whether they were in a hospital setting or not, maybe they started to experience some of the symptoms after they, recovered, and maybe they've gone to rehab or they haven't, that if they need to continue to maybe use exercise as a modality to help maybe improve their levels of conditioning, to improve their breathing, etc. We have a program here that, as I say, we just recently started to try to address those issues with people. The nature of the program, the way it's set up, patients can come in twice a week for about an hour a session. And once again, based on their medical history and where they particularly are, we'll do some pre-testing to get a baseline on them. Simple 6-minute walk, some simple musculoskeletal tests just to give us a sense of, where they are functioning. And then we'll develop an individualized program for them where half of the time here, if appropriate, we'll do cardiorespiratory exercises or aerobic to help improve the function of heart, lung, circulatory system. And then we'll also do a functional weight training program for them to, not turn them into the Incredible Hulks, but just to build up functional levels of muscular strength, upper extremities, lower extremities, core, balance issues if we need to address, to, see if we can gradually help them along to progress, from this, the symptoms of COVID.
Which, well, again, all is terrific because as a physician who's taking care of a lot of these people, you do find that at the end, even 2 weeks, a month afterwards, I've had people get home physical therapy in order to just get them walking and doing things, and that they do need some type of an outpatient rehab service in order to get them more functioning. And I don't mind if you want to turn them into the Incredible Hulk. I don't mind if you do that. But at least if we can get them back to doing everything they had done prior to the COVID, that would be terrific.
Can I add a little bit here?
Of course.
So I've had the unique experience of treating people pre-COVID and then having them return to us after the fact. Some of our post-COVID patients I've never met before. So when somebody walks in with a walker and can barely walk across the floor without tremors and looks frail and almost looks 30 years older than they actually are when they walk in. And as they begin their treatment, as Gary said, for let's say, elbow pain from being in a hospital bed with a trach in for months, or then going to subacute rehab, the continuum of getting them from an ICU bed sometimes to rehab, to home care, to outpatient. I see them when their former self has kind of wasted away a little bit, and they're I say almost half the person they used to be. But I've seen them also pre and post, and some of my orthopedic patients who had, let's say, a mild case, as Gary said, the brain fog, there's definitely some short-term memory issues afterwards, and I can't instruct them even the same way I used to, because they need more cueing, they need more reinforcement, they need more guidance. So it's not just my elbows hurt from, being in the bed for 2-3 months, or my legs are weak and I'm falling. There's so many, as Gary said, issues with shortness of breath, the depression, the anxiety, and the feeling of I'm not who I used to be. And that's where, we figure out where are the pains. right? And we try and address and make sure that those pains start to go away and then restore the balance, restore the strength, and restore the range of motion so that they can get back to work or they can feel like capable people in taking care of themselves and their families and such. So, Gary, that's fantastic. I'm absolutely thrilled that you guys developed that program.
Yeah. So if you have anybody who's done with your rehab, they need to continue.
Yeah, absolutely. I'm thrilled about that. Absolutely. Thank you.
And we do, and for any of the patients that do come to us in either the phase 3 or this post-COVID program, we do require medical clearance. Mm-hmm. So we would need a note from a referring physician stating that, it's safe to exercise, and we welcome if they want to put down any type of restrictions or limitations. So he helps us dealing with the patient. Yeah.
Now, as a result of the COVID pandemic, physicians such as myself, as well as physical therapists, exercise physiologists, have had to unfortunately go towards telehealth services, which of course for physical therapy is not the same as being next to the physical therapist and doing one-on-one type of thing. Patients choose to do their rehab sessions remotely due to the comfort that they feel and the convenience in their own home. Can you tell us, Danielle, how telehealth physical therapy works and what you've learned?
Sure. We've had multiple cases where it's actually been COVID that has sidelined people. We had an existing patient who was coming to therapy in person and then was either quarantined because of being diagnosed or was quarantined because of being exposed. But he was a post-surgical patient who, if we stop therapy and they sit home for 10 days to 14 days and yes, they're given a home exercise program, but it might have been the initial phases of their therapy. So the patients rely on us for direction, for how to progress themselves. How much should I move my elbow? How much should I feel pain when I stretch it? So in this case, the gentleman was able to do teleconferencing with the therapist, and they were able to, assess the scar, make sure there's no infection, assess range of motion, see if they're losing any motion or continuing to gain, and also, look at the patient's home exercises with them and the exercises they're performing and making sure they're doing them correctly and answering any immediate questions that they have. Another case is a patient who never even started yet. They were on the schedule for an evaluation, and they were exposed and then tested positive, and they were a post-op patient as well and ankle surgery. So, those start dates are very important to get somebody moving and not sitting around for an additional 14 days while they're healing. So we were able to evaluate that patient, through the telemedicine portal. And I was able to watch her walk. I was able to watch her get up and down and see how much trouble she was having. Was she wearing her boot effectively? Was it comfortable? We can check those things and make sure the patient is comfortable, right? They get their questions answered. They get immediate direction on where do I go from here? And we can monitor any ill responses to what they're trying to do. Whereas if you were on your own and you said, here, do these exercises, good luck, they couldn't ask us the questions. We couldn't see that they were doing something incorrectly.
Well, that most people, if I just gave them a list of exercises, after one day, they're going to stop doing them and they're not going to get any better. And the only way to get through all of these injuries or any type of surgery is good physical therapy. And I want a physical therapist who's going to be whipping me so that I do as much as I humanly can do, because I'd like to return to the way I was beforehand. For those patients who do want to come into your facility, I'm sure you have set aside certain protocols in order for them to come in.
Gary, do you want to address that one?
Yeah, I can take that one. Generally speaking, for all the off-site facilities and even the hospital facilities, there are precautions prior to anybody even walking in the building. And I know that because I used to do some of the screening over at the hospital for a while. But prior to entering any of their buildings, whether you're a staff, whether you're a patient, or even, I guess, visitors when they start allowing them, you have to have your temperature checked to make sure that's within reason. You're asked a series of questions if you have any kind of signs or symptoms that are related to COVID. And we also ask, have you traveled in the last 2 weeks? And if you did, where? So hopefully if everybody passes that initial screen, they get to come into the building. Now, once inside the building, all staff, once again, patients and visitors, they have to wear masks, and particularly like on our outpatient facilities, like where Danielle works and also myself, we try to, they make sure that they have a hospital-grade surgical mask on. They have to make sure as best as possible, we try to keep the social distancing. Any piece of equipment or modality that is used by a patient is wiped down immediately after and sanitized after any type of usage. And, that's what we're trying to do to protect people, limit the amount of people in the facility. At our particular facility here in Hillsborough for cardiac rehab right now, we only allow no more than 5 patients at a time.
Good.
So I don't know what they have over at the ballpark, but I know you have a bigger space than what we have here.
Yeah, we have a lot more people, but everybody is masked. Everybody sanitizes in, sanitizes out, dumbbells, things like that, where they're touching, they're immediately put once they're used into the used section where they're then wiped down with the proper sanitizer and placed onto their racks where they are now clean. So we always tell people, whatever you're not comfortable with, if there's ever any concern for your safety, we can discuss that. And you don't have to come at one of the times when maybe there's, more people in the room than you're comfortable with. And we'll try and schedule their times in maybe on a Saturday or a weeknight or early morning. Those are usually our not so busy times. So, but they can always express to us their concerns.
Lastly, New Jersey allows direct access for physical therapy services. Do you want to quickly just tell us a little bit how that works with physical therapy?
Sure. So we are allowed to practice without a physician's referral or prescription. So a patient would not need to go to the doctor and say, I would like physical therapy, or sometimes they don't even know what they need. They say, my neck hurts, and you write a prescription and refer them to physical therapy. In New Jersey, we are allowed to evaluate a patient and determine the appropriateness of this patient for physical therapy and determine a plan of care. Certain things, so that allows them to just say, I need physical therapy, or I think I need physical therapy, and I would like to go. So we will call, they will call us, we will assess, take all their information, and then they can come in as a direct access patient. Which means they haven't gone through the gatekeeper, which is their doctor, to get to us. In many cases, if they respond appropriately, favorably, and in a short amount of time, there's no need for them to go to the doctor to be evaluated for that reason. If their shoulder problem got better and they didn't need to, be referred to the doctor, then that's great. They're done. However, in the cases where maybe somebody's showing some sinister signs, things that concern us that maybe seem something medical in nature that would require a doctor's intervention and workup, we would refer them to the doctor to then say, look, you definitely need to be at least evaluated by the doctor. And then when they've cleared you for continued therapy, you can come back to us with a prescription. Certain insurances, however, do make it mandatory that you have a doctor's referral or a prescription. So something like a motor vehicle or a workers' comp, or in some cases, different insurance companies do require the physician's prescription in order to say, we'll pay for your therapy and we'll reimburse the therapy. So you always have to check with that.
Thank you both for being here. Thank you for all you do for RWJBarnabas Health Somerset Hospital. And thank you for getting people to look like the Hulk.
You're very welcome. Thanks for your referrals.
Thank you very much.
This concludes today's episode of Robert Wood Johnson University Hospital Somerset's Health Talk. Please remember that the opinions expressed here by our medical experts are not a substitute for medical advice from your own physician. If you need a physician, please call our physician referral line at 888-724-7123. For more information about rehabilitation services at Robert Wood Johnson University Hospital, Somerset, which includes 7 physical therapy locations throughout central New Jersey and cardiac rehabilitation in Hillsborough, please visit us at www.rwjbh.org/Somerset.